Namaste viewers, welcome to Sri Anantha YouTube channel. In this episode, Swamiji will continue discussing the central nervous system and focus on tongue disorder.
Embodiments of love. Today I am going to discuss with you regarding the central nervous system part 1, in which we have covered almost all the subjects, and the last one is the tongue disorder, which is on our face. So there are several tongue disorders that can affect individuals. Here are few examples. First one is glossitis, inflammation on the tongue, often resulting in a swollen or red tongue, which you can see. Geographic tongue, a condition where tongue has patches that appear like a map with irregular borders and different shades of colors. Then fissured tongue, characterized by deep grooves or cracks on the surface of the tongue. Then black hairy tongue, a harmless condition where the papillae on the surface of the tongue become excessively long and can appear black or brown. Then next one is thrush, caused by overgrowth of the fungus candida, resulting in white patches on the tongue and inside the mouth. And certain cases like burning mouth syndrome, a chronic condition characterized by a burning sensation on the tongue, lips and other areas of mouth. Oral lichen planus, an inflammatory condition that can affect the tongue, causing white, lacy patches, redness and discomfort. And further aggravation, if you see, that is oral cancer. Tongue cancer is a type of oral cancer that can cause sores, ulcers or growths on the tongue. Leukoplakia, this is also a type of cancer only, but a condition where thick and white patches develops on the tongue, often caused by irritation or chronic tobacco use. Macroglossia, this is another term, a condition characterized by abnormally large tongue, which can cause difficulties in speech, eating and breathing. And oral cancer, there are several risk factors associated with this that can increase the likelihood of developing the disease. Here are some common causes and risk factors associated with oral cancer. So tobacco use, mostly if we see people are smoking cigarette, cigars, pipes, or using smokeless tobacco products, which increases the risk of developing oral cancer. This includes both direct tobacco uses and exposure to secondhand smoke. In case of alcohol consumption, where heavy drinking, especially combined with tobacco use, significantly increases the risk of oral cancer. Alcohol can irritate the lining of the mouth and make it more susceptible to cancer-causing agents. Human papilloma virus infection, certain strains of HPV, such as HPV-16, what we called, and HPV-18 are known to increase the risk of oral cancer. HPV is a sexually transmitted infection that can be transmitted through oral sex. So, sun exposure is also one of the cause. Prolonged exposure to the sun's ultraviolet rays can increase the risk of lip cancer. Using lip balms or lipsticks with sunscreen can help protect the lips from UV damage. And next one is poor oral hygiene. Neglecting poor oral hygiene can lead to chronic irritation and inflammation of the oral tissues, which can increase the risk of oral cancer. And one more cause can be the diet. A diet low in fruits and vegetables, as well as deficiencies in certain vitamins and minerals, may increase the risk of oral cancer. Age and gender is also one of the causes, where oral cancer is more common in individuals over the age of 45, and men are twice as likely to develop oral cancer compared to women. It is important to note that having one or more of these risk factors does not guarantee the development of oral cancers. Regular dental checkup is immense, and maintaining good oral hygiene and practices can help detect early signs of oral cancer and improve overall oral health. So, arteries related to the tongues, which we can manipulate and stimulate, is that the tongue is primarily supplied with blood by two main arteries, which is the lingual artery and the dorsal lingual artery. These are the two arteries with which can manipulate and stimulate any type of oral disease. The lingual artery is a branch of the external carotid artery, which is a major artery in the neck. It runs alongside the hyoglossus muscles and enters the tongue from the bottom surface. The lingual artery provides blood supply to the anterior 2/3 of the tongue. The dorsal lingual artery is a branch of lingual artery and supplies the posterior, the 1/3 of the tongue. It runs on the upper surface of the tongue, parallel to the lingual vein. So, both arteries provide oxygenated blood and nutrition to the tongue muscles and tissues, allowing for proper functioning and sensation. So, how we are manipulating and stimulating the tongue disease through these two arteries, lingual artery and dorsal lingual artery, we have explained. So, with this, we can completely prevent, cure or maintain through our vermology. So, anyone have such kind of ailments, tongue disorders, definitely visit to our institution and all your disorders can be revived through vermology. So, stay blessed. Om Sri Sai Ram.